viewers. I'm Irka Maharani as the host of Prodita English Podcast today. And our topic today is about diabetes mellitus management between Indonesia and Philippines. As we know, diabetes mellitus cases in the world is increasing rapidly, and diabetes mellitus is becoming an urgent health issues around the world. And today we have a very special two speakers actually from Indonesia and Philippines. We have Mr. Agus from Indonesia and also Dr. Joel from Philippines. How are you today, Mr. Agus?
Alhamdulillah, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. How are you, Dr. Joel?
Well, I'm good and I'm happy to be here with you.
Okay. Well, everyone, so it's about talking. We are going to talk about diabetes mellitus management between Indonesia and Philippines.
Okay.
Yeah. As we know, there are if in Indonesia there are 5 pillars of diabetes mellitus. Think about that, Mr. Agus.
Yeah, thank you very much for your asking, Ms. Irka, and thank you very much for your attendance, Dr. Joel. I will be my note about the 5 pillars for diabetes mellitus management in Indonesia. Because of diabetes is so many people have diabetes in Indonesia, the government, especially in Ministry of Health in Republic Indonesia, make a good program to maybe to manage the diabetes mellitus, not only for the promotion prevent but also cure and then maybe to rehabilitation because of the acute complication for diabetes mellitus. 5 pillar means in Indonesia maybe 5 pilar atau tahap for reduce the number of diabetes mellitus patients and to reduce complication. Number 1, education, nutritional therapy, physical activity, pharmacology, and monitoring. Okay, maybe in Indonesia we have the abbreviation cerdik.
Oh,
cerdik. Ya, cerdik.
What is cerdik stand for?
Cerdik in Indonesia ini C, cek kesehatan rutin. E, enyahkan asap rokok. R, rajin olahraga, sport. And then D, diet seimbang, nutritional therapy. And then E, istirahat yang cukup, the rest, enough rest. And then K, kelola stres atau stress management. That's all to make a healthy life. Healthy life make prevent diabetes mellitus exactly for type 2.
Oh,
okay,
yeah.
for type 2 diabetes mellitus. I think that's all.
Okay, thank you, Pak Agus. So for Indonesian government, there are 5 pillars, and also we call in Bahasa Indonesia cerdik one. And how about in Philippines? Is there any certain programs from the government from the Philippines about management of diabetes mellitus? What do you think about that, Dr. Joel?
Yeah, I think we have the same pillars that we are sharing right now. Aside from the education, exercise, nutrition, and maybe we have to also include here the accessibility and availability of our resources. Because in the Philippines, we always believe that prevention is better than cure. Because, as I've said, the non-communicable disease, just like diabetes, is highly preventable. So we do not wait for the person to get sick. And we should have to prevent that at the community level. But there might be problems, aside from the 5 pillars, we share the same pillars, but I'd like to add on the accessibility and availability, because there might be accessible health facilities, but there is no available resources. There may be the house is near to the community center, but there is no services available. No people, no medicine, no healthcare practitioners can be. So there is access, but not available resources. There are also cases where we have available resources, but sometimes it's not accessible to the community because that's very far from where they live. So I think we can think of some strategies later on to add the pillar, because it has to be like equal or to be like fair. Accessibility, availability, sometimes the quality of our service, and the affordability if we need some medications. Yeah. So that's in addition to the 5 pillars in Indonesia.
And
I think so with Indonesia about the resources for health worker exactly in Puskesmas, maybe in community health services, and then there's the big problem to get human resources, exactly doctor and nurse, and then maybe we must be able to make a good cooperation with maybe with university, with community, and then with government, and to prevent the diabetes mellitus. Not only to prevent but also to cure, rehabilitation, and manage the budget to overcome any problem because of diabetes mellitus.
Okay. Well, viewers, so we have programs. The government have programs, and not only from Indonesia but also Philippines have program. But there's always like some challenges, to like maintaining the programs to make it run well. Yes. And how about the role of health insurance? If in Indonesia we call like BPJS, or maybe in Philippines, is there any like mandatory health insurance for people in Philippines?
In the Philippines
From
we have
government, maybe?
from government.
government.
We have this what we call PHIC. We call it PhilHealth, Philippine Health Insurance Company. It's actually a subsidized health care for especially those with underprivileged. So right now in the Philippines, we have more underprivileged Filipinos, and we in the working or industry sector, our taxation will be given part of that to address the health care of our population. We have this strategy now that when they are admitted to the hospital, there is zero billing process, meaning they do not pay anything.
So it's totally free.
It's totally free. But at first it's okay, but sometimes it is not in a way healthy for a long term because
Continuously.
sometimes we are teaching our people on how to just to depend on the government and not really doing their share in their healthcare concerns. But that's one of the program actually, and we are trying to make sure to have a healthy balance of well people in the Philippines, because when our nation is having this kind of sick people, then no more health workers. There will be poor in terms of business running the operation because we have sick people. That's the intention, the agenda of the administration of the Philippines, to ensure to have fair and access to healthcare as much as possible.
Maybe in Indonesia, BPJS is covers all of the services for the people with diabetes mellitus, but the big problem is not continuously to pay about assurance for the BPJS, and sometimes this is the big problem for the hospital from the central health services or Puskesmas to give cure and care for the patient. Maybe we have, as a university, we have the function to promote, to interfere that problem with the give stimulation for the community to be able to self care for all of the people around them, and not only for academic lecturer student, but also for all the community to overcome the problem about diabetes mellitus. I think that's all.
I think if I may add, I would agree to what Dr. Agu said, that it's not the healthcare issue of a certain country is not really the main concern of the government. It is a shared responsibility with different industries. Like example, in the universities, when we have like a nursing program, a health-related program, we have this mandate to conduct community services as our extension to address the preventable kind of diseases through education, because we are experts in education as a university. We are mandated to make research, to create new findings. So this, in a way, maybe not directly towards financial aspects of healthcare, but I always believe that in education, when there is proper relay of correct information, we can prevent the burden to having this increased prevalence of key cases or diseases to our patients. So I always have to agree with Dr. Agus that the university must make a strong step, a bold step in the promotion and prevention part through teaching, because this is why we are in the university. We are bound to become experts, to generate knowledge, to extend services, so we can help to attain the SDG number 3,
SDGs.
which is good health and well-being, and through quality education as well.
So the role of the university is very
Important.
significant and important.
Yes.
Yeah.
Yeah, similar with our university at Polytechnic Malang, the Nursing Study Program, we try to make a diabetic nursing center care. That's a unit to overcome any problem in diabetic, not only for the community, but also to improve my knowledge, skill, and attitude for the lecturer and student to overcome diabetes mellitus, not only prevent but also the care and cure in the community. And we have 3 kind of field in diabetic nursing care: polyneuropathy diabetic, wound care diabetic, and then the last, innovation for diabetic. We make a device, a simple device to overcome any problem because diabetic, maybe to support diet, to support wound care, to relieve pain in polyneuropathy. That is just prototype, the simple prototype, but very important for us.
Yes. For your information, Dr. Joel, Mr. Agus is very good and expert in like innovations, technology. Yeah.
And that's what actually we can contribute as a
Yes, of
university,
course.
innovation, because the government may have the resources but don't have the correct people that would help them in realizing the program. They're just thinking just to give the money, to continue buy the medicines, but this may not be the kind of need our community right now is needing. There might be some innovation, very specific according to their needs, that medications or money from the government is not really the exact or appropriate response. So I commend, I express my congratulations to POCASMA, to your study, for coming up with this innovation.
Yeah.
Yes, okay. Due to the limited time, Dr. Joel and Mr. Agus, maybe this is my last question for both of you. It's about, like, as we know, diabetes mellitus is one of the non-communicable diseases. The preventive program is very important as well. And what do you think about the early detections? So we maybe for the society, it's very important to know the early detections, and then when I have to come to the medicines to check, and it can avoid the self-diagnose, maybe like you said before in the international guest lecture. So what do you think about that?
Yeah, I think we should improve how our community people think about going or seeking hospital care. With or without disease. We have to make sure that we visit the hospital for a wellness checkup.
Oh,
Because
yes.
the wellness checkup is a way to detect early if there are abnormalities already. Well, maybe because it's part of our culture, and in Asia, the ASEAN culture, that we have pain tolerance and pain threshold, very long pain tolerance. We do not go for the doctor or seek consultation if we know that we can still thrive, that we can still, have the energy to withstand among the pain. That's a good sign of being resilient individual. But sometimes when our health-seeking behavior, the ability to utilize resources even when we do not feel anything bad about health is decreased. We only go to the hospital when we are already on severe pain or
Yes.
severe disease. So I think the first education we should do is to increase awareness that going to the hospital or clinic is not for ill patient, but even to well client, because that's an early detection if there are abnormalities.
We have to change that mindset.
Yeah, that mindset that the hospital and clinic are for this, not for the sick people, but also to well people like us. Because the World Health Organization defines health as not in the absence of disease. Even if we're okay, but mentally we're not okay, we are not totally in good health state. Correct. So the disease is only the physical component. What about the emotional? What about the psychological? What about the spiritual? Which is sometimes neglected most of the time, maybe, because we are so focused on the medicine to have decreased our signs and symptoms. So the mindset of changing that hospitals and clinics are both for well and ill patients
Yes.
are also there giving equal service.
I think similar between Indonesia and Philippines to make comprehend all the society, comprehend about the diabetes mellitus to early detection and early diagnosis and early treatment, of course. And then I believe because the lack of the human resources, health worker, very difficult to share the knowledge for the society. And this is the opportunity for the academic lecturer and student to help the government to promote and to educate all of the people about the diabetes mellitus, especially to check regularly.
Yes, that's one of the program. That's one of the program of Cerdik.
Cerdik and Prolanis and maybe PTM,
Yes.
like that's one to prevent diabetes early. And then I believe we must make a good cooperation relationship, government, academic, and university, and the people, and maybe a cadre, head cadre. We have head cadre, and posyandu maybe. What's in English the posyandu, pos pelayanan terpadu for the from the society to the society, from the community for the community.
But sometimes, Mr. Ratus, like Indonesians, like afraid to come to the healthcare because if I came to the healthcare, so
because I
will be
all the go to the hospital sick, go to the clinic sick. Not all of the people go to the clinic sick. And then clinic maybe not only cure treatment, but also to promotion. Promotion using Prolanis program and health education for the community.
So I think maybe for the hospitals or the health service can like have a preventive program as well, not only for the curing program.
How about your student, Mr. Joel?
Our students are as early as year 2 are already exposed to community health nursing. Because we have this community program. It's always focused on the promotion and prevention. We do not touch about the curative component because that's beyond their scope in the community. And we always emphasize to them that there will be lesser patients in the hospital if we make good at the promotive and preventive level. So that means that the health system will not be burdened and will not be overwhelmed later on because we are actually investing so much on prevention of the disease.
Okay, that's very exciting topic, everyone. But our time is very limited. And do you have any closing statements, maybe?
Okay, the last statement. Thank you very much for Dr. Joel. This is interesting activities this morning up to now, and I believe this event is very important for us. Thank you very much to improve our knowledge.
Maybe we can have next cooperations with this.
Maybe I want to your student and my student exchange for the interesting discussion about nursing maybe, and this is not only to prove our English ability, but also to comprehend what international knowledge about nursing.
So our knowledge will be like globally.
Globally.
Do you have any like closing statements?
Yeah, first I would like to thank you for having me around. I know
Yeah.
this is a very short time, but it is very fruitful, and we're looking forward to have more activities and collaborations with you. Rest assured that we will always be, the Visayas State University Faculty of Nursing will always welcome for forms of collaborations through research, academic exchanges, student exchanges,
Mobility service.
mobilities, community service, and the like. This is not really for us, faculty members, but for the enhancement and improvement of our nursing students as future members of our healthcare forces.
Okay.
Thank you so
Well,
much.
thank you everyone and see you. Goodbye.
Goodbye. Thank you very
Thank
much.
you.
Dr.
Thank
Joel,
you.
thank you very
Thank
much.
you so
Thank
much.
you.